Good evening and welcome to the 164th monthly meeting of FOSWL. I think just one or two people are there. FOSWL who are new. FOSWL stands for Friends on Same Wavelength. That's the acronym. And we have monthly meetings on the third Saturday of the month without fail at 6:15 on Zoom now. Earlier it was a physical meeting. Before we commence the evening's proceedings, let me extend, on behalf of the President of FOSWL Hyderabad, a warm greetings on the occasion of our 76th Independence Day, which we recently celebrated. And I'm sure all of us were very, swollen with pride to see the kind of celebrations that took place across the country. I think many of us who were born after the independence do not realize the value of freedom. But in this forum, especially, there are many who were born before freedom was attained. So it is of a special significance to members of FOSWL. With that, again, on behalf of the President of FOSWL Hyderabad, I welcome all of you to the 164th monthly meeting. And without much ado, I'd like to call upon a very young lad. He is in the 10th class he is currently studying in 10th class in Gitanjali, Devashray, Parikshit Surana, to read the prayer. Parikshit, you can unmute yourself and read the prayer.
Good evening, one and all. My name is Parikshit, and I am here to tell the prayer. Heaven of freedom, where the mind is without fear and the head is held high, where the knowledge is free, where the world has not been broken up into fragments by narrow domestic walls, where the words come out from the depth of truth, where tireless striving stretches its arms towards perfection, where the clear stream of reason has not lost its way into the dreary desert sand of dead habit, where the mind is led forward by thee into ever-widening thought and action. Into that heaven of freedom, my Father, let my country awake. Thank you.
Thank you, Parikshit. Parikshit is an ambitious young man. He is aiming to attempt the civil services and has started his preparation right now. In fact, a year ago. So good to have you on this meeting, Parikshit. It is often a difficult task to introduce somebody who is already known in the public domain as well as to many people on this call as well. But nevertheless, there are facets of each person's life which are not so well known. Some of them at least. I'd like to call upon another young person, Catherine Sushmita. She is a student of pharmacy. She is doing a doctorate in pharmacy and she'll be graduating in a couple of months, I think in the next month itself. Catherine, would you introduce Dr. Varaprasad Reddy to us?
President of FOSWL, distinguished speaker, ladies and gentlemen, good evening and welcome to today's monthly FOSWL meeting. Before I take the pleasure of introducing our guest speaker, please allow me to express my gratitude to Mr. Subbarao sir for giving me the opportunity to participate in this event and granting me the honor of introducing our distinguished speaker, Dr. Varaprasad Reddy. I would also like to congratulate the entire team of FOSWL for all their efforts in hosting this 164th monthly FOSWL meeting. Dr. Varaprasad Reddy founded Shantha Biotechnics Limited in 1993. Shantha Biotechnics is an Indian biotechnology company based in Hyderabad. It is the first Indian company to develop, manufacture, and market recombinant human healthcare products in India. Shantha Biotechnics Limited was the first to develop and produce the first indigenous rDNA hepatitis B vaccine, followed by several other high-end vaccines and drugs of international standards, made available at an affordable price. In the same spirit of producing low-cost and high-efficacious products, several vaccines were developed which were approved by the WHO. Recently, Sanofi Group has acquired majority stake in Shantha Biotechnics. Dr. Varaprasad Reddy continues to be the chairman of the company. Dr. Varaprasad Reddy has many prestigious awards to his credit, with the most prestigious one being the Padma Bhushan, awarded by the Government of India in 2005, and the most recent one being the Lifetime Achievement Award in 2019 by the CEO's Club India, amongst several other awards, including Lifetime Achievement Awards from the Institution of Engineers India, Hyderabad Management Association, HMTV, Entrepreneur of the Year Award for Healthcare and Life Sciences by Ernst and Young in 2000, National Technology Award for Shanwak B in 1999, and Shanferon in 2003. Department of Scientific Industrial Research Award by the Government of India for Best R&D Efforts in Industry for Shanwak B in 1998 and for Shanferon in 2003. He is on the boards of several organizations as the patron at ABLE, member of AIBA, member of BCIL, life member of Federation of Asian Biotech Associations, member of Indian Institute of Public Administration, and at National Biopharma Mission as the chairman of the Technical Advisory Group, initiated by Biotechnology Industry Research Assistance Council. He is serving as a director on the board of several companies like Shantha Biotechnics Private Limited, India, Sparsha Pharma International Private Limited, India, Sparsha Pharma Incorporated, USA, Advanced Bioscience Laboratories Incorporated, USA, Diabatomics Medical Private Limited, India, Diabatomics Incorporated, USA.
Thank
With
you.
a brief introduction, I'd like to present to you Dr. Varaprasad Reddy, our distinguished speaker for the evening. Thank you.
Thank you, Catherine. I think you did a good job of making it so short. I don't think it was an easy task.
Yes, sir.
Every meeting of FOSWL is an endowment lecture. And today, Dr. Varaprasad Reddy's lecture is to honor the life and work of a person who made a significant difference in the country's bakery industry. And he is Sri Returi Bhaskar Rao, popularly known as Professor R.B. Rao. In the 1950s, he went to the UK and graduated with honors in these food technologies, came back, worked in CFTRI in Mysore. And some of our old members may remember that he is the person who introduced mechanized sliced bread for the first time in the country in the 1950s in Delhi to start with. And then he worked for a very long time and retired as the technical director of Britannia. So today's talk of Dr. Varaprasad Reddy is apt that he is delivering this because Dr. R.B. Rao, Professor R.B. Rao was also a pioneer in the food industry, and he was regarded as the role model, especially in the biscuit industry, having worked in Britannia for a very long time. And before I call upon Dr. Varaprasad Reddy, I just noticed that Mr. Professor T.J. Ramurthy has joined us from Bangalore. Professor Ramurthy, are you there, sir?
Good evening, Subbarao. This is third time I'm joining.
No,
I was
not
only
at all.
wondering. I was only wondering that you will be able to recognize.
No, sir, I just saw your name. I want to pay my respects to my teacher from college. Professor Ramurthy was my electrical engineering teacher in RV College of Engineering. I'm so delighted you're here, sir. I spoke to Dr. Ranganath Shetty also.
Wonderful. Yeah.
My pranams to you as my
Thank
guru.
you.
Nice to see you.
Subbarao.
Yeah.
Okay. Thank you for welcome.
Thank you.
Right.
Yeah.
Okay.
It has been a fascinating, few conversations that I had with Varaprasad Reddy. I first met him about 30, 40 years ago. I was narrating to him the incident when he was in APEDC for a brief while. And I was toying with the idea of setting up a small scale unit to manufacture 10,000 push button telephones. And I was so overjoyed that I managed to get a license from the Department of Science and Technology after a year of running around Delhi. And I could not really fathom the Shantha Biotechnic Varaprasad Reddy in my conversations with this person you see with us on the screen now. Sometimes it may seem, in Telugu we say atisayokti, trying to make it patronize or say more than what is true. But I leave it to you to gauge by the end of this meeting the kind of persona that Varaprasad Reddy Garu has become and the spirituality that he has embraced after a huge success in a scientific field. He has done our country proud, he has done our state proud, he has done his village proud, but yet he wears all this with such a great sense of humility that it's almost disarming. May I now request you, Dr. Varaprasad Reddy, to share with us your life journey and the lessons gleaned from that. And incidentally, he has asked us a question. He can either speak for some time and take questions at the end of it, like we normally do, or if you prefer that he speaks for the entire duration, he has assured that he will answer all questions by email. So by a show of hands, if you can just indicate to me what you prefer, would you like him to take up the questions now at the end of his talk? Just raise your hand, please. I don't see many hands. I need some guidance here. So does the speaker. Just raise your hand if you want him to answer questions live.
I myself raise the hand.
Okay. So I think the decision is made. So the floor is yours if you want to share your screen, Dr. Varaprasad Reddy.
Namaskar to everyone. I am suggested to speak English because there are many non-Telugu people. I made a oath to myself that I will speak to my Telugu people only in Telugu. But once in a while, from English, please allow me to switch to my mother tongue Telugu so that I have not defied my own oath. Once in a while, where there are certain idiomatic expressions, only in mother tongue one can express very effectively. That's where I take the shelter of mother tongue, and you can understand what I mean because you're all in state of Andhra Pradesh. Maybe some people are from Bangalore. I was given the topic of social entrepreneurism. In fact, entrepreneur itself is very, what you call, strange word. We all know many industrialists, but not many entrepreneurs. But in recent times, every startup company, we are calling them as started by entrepreneurs. at least around 2 decades back, entrepreneur word is little new to the industrial community. He's an industrialist, that is the standard word. But there is a subtle difference between entrepreneur and an industrialist. I will just go through two, three counts. He is different from industrialist. An entrepreneur should be a radical thinker. Industrialist need not be. He has to be more logical. He should be irrational in his desire for change. Entrepreneur should be very irrational. Unless he is irrational, he cannot put his foot forward. Industrialist will think twice before he takes any initiative for a new project or a new line, because he has everything attained, money, name, fame, everything, and he doesn't want to risk it. The risk-taking capacity will go down as he becomes an industrialist or he is growing as an industrialist. As an entrepreneur, he has nothing except his idea. He may not have gathered much mass with him. So he'll be very, very risk-taking capacity. He has highest risk-taking capacity and he is in a hurry to do something. And he should be having high tolerance to put up with ridicule and insults. An industrialist will be very careful to save his image. And also he should be tenacious to put up with uncertain results. He has no calculation with him. Whereas the industrialist has many people to guide him, advise him, his auditors, his finance manager, financial controller, friends who are well versed with the industry. He has much contacts. So he'll be discussing his new ideas to make sure that whether they are technically feasible, financially viable, all these kind of legwork he will do. An entrepreneur cannot have all that luxury. He has an idea, he takes it up, he will run after it without rhyme and reason, except that he wanted to bring a change in the present one. Either it be a product or it could be a service. He wanted to do something new. That is entrepreneur. But if you add social entrepreneur, it is qualifying an entrepreneur that he will not run after everything. It will occur to him only when there is a need, there is a concern as far as society is concerned, his environment. If he is finding something going very untoward things are happening in the society, or there is a need in the society for such a product or for a service, for the lack of it, society is suffering, then he can take a call. That kind of person is called social entrepreneur. He will not go by routine method of zeroing on a project. A seasoned industrialist will have all the calculations. He has a template. He will first see whether the product I am taking up is having priority. Is it in priority sector of the government? Whether government is giving any concessions for that. Also, he will see whether there is any favorable response from the bank for this kind of products or service. Third thing he sees that what is the technical obsolescence? How long this technology will last? Will I have to search for new projects later on? What is the product life cycle, etc. He will calculate. Not only that, he will look into ACGR, annual compounded growth rate. He will look into asset ratios like return on investment, return on equity, all kinds of jugglery. Unless he does that exercise, he will not come into the project. An entrepreneur doesn't know all these things. Most probably he'll be fresh from the college, or maybe he has some experience as an employee. So he cannot have this knowledge about calculating and taking a logical decision to start an industry. So social entrepreneurship is what in my opinion is a person who is affected by the environment and who has felt a need that he should take up something for the good of the society, then he is called a social entrepreneur. Then you can ask a question, a social enterprise, how it can help himself. Social enterprise it is not for making money. It is for doing something good to the society. If I am taking good care of the society, who will take care of me? That question will occur to him. So the answer for that is samskara to tell him, or else the environment should teach him that Sangho Rakshati Rakshitaha. That is our Vedavaku. So if you take care of society, society will automatically take care of you. That is the Nanudi in Vedas. If he understands that philosophy, he will definitely plunge into the action and he will take up. And if you do, not only that, because of his noble thinking for the society, not for making money, my belief, my faith is that it is a noble, he is doing that project for a noble cause. An unknown forces, you call it Daivam, you call it Shakti, you call it nature, it will definitely come to his rescue, and he will be bestowed with all the power, might, and necessary support system. The entire universe will conspire to make it happen. In my opinion, he will be safer because his decision was to take up a project for the cause of society. If the objective is only to make money, there are many industries one he can think of. Even making liquor also is a very profitable business. Only one customer. Every annually, the government itself will raise its price. No need for any marketing team or designing a great marketing, strategy. So it is automatically done without any marketing team or sales force. One product, one customer, supply them every year, annual growth is there. You will be better off. But that is not the social entrepreneurship. That is not a project which is meant for helping society or people. It may give money, but it will not help. Such kind of projects are many, and all of them need not be successful, and all of them need not be failures. Some of them are successful based on several other factors. But if it is for a social purpose, I don't think any social entrepreneur has so far failed. That is my belief and faith. There may be some hardships for him to go through the journey, but ultimately he'll be winning. What for he is taking the journey will prove him that he has done the right thing. He will have atma satisfaction, self-satisfaction, and at the end of the day, more than the money, he will live in peace, he will sleep well, and he will be definitely feeling good, and he can encourage other people also to follow the same path. The proof is my journey, Shantha Biotechnic, and I have to give you some backdrop of the thinking. When I started in 1991, I had this idea of starting up a biotech company, but it is not, I cannot tell any lie to you saying that I had the vision of doing something great in this country to save the people. I thought of doing something in healthcare. No, nothing of that sort. In fact, my background is electronics engineering. I have nothing to do with life sciences. And I have, as usual, as any ordinary student, I joined a job. I was not a job provider. At that time, I never thought of being an entrepreneur also. That kind of thinking was not there with me. I was a raw student. I passed out my engineering. I did my master's. Then I thought of joining a job. In those days, getting a job in defense labs is very difficult. That too in R&D. My passion was R&D. Somehow I believed that R&D is the one which will give me a satisfaction, not the routine stereotype production. So when I joined DLRL, Defense Electronics Research Lab, I was an ordinary employee. I never had this idealism of doing something for the country, but I noticed that the job I am doing in DLRL has not given me any satisfaction. That is meant for import substitution. Our entire defense forces should be given an adequate support system to have an effective war. Unfortunately, the money that was pumped into DRDO is very high at the time. I'm talking about 1970s. I joined the DLR in 1971. And the outcome of any DRDO was not well utilized by our armed forces, Ministry of Defense. They were doing their job of developing indigenizing some of the equipment, but ultimately our armed forces and defense department was inclined to import things which already were at least made here as a prototypes. They never encouraged to continue the prototype section to regular production. That gave me some disappointment. I left the job. Then I joined an organization in state government for promoting electronics industries. So far, my experience in DLR was only to do R&D in electronics. Jammer controls was my subject in DLR. When I came to state government for promoting electronic industries, I could not understand how to read a balance sheet. In AP IDC, there was a subunit called AP Electronics Development Corporation. Because my background is electronics, they asked me to promote electronic industries. And in those days, there was joint venture concept. Government gets the license from the central government. State government will get the license from central government. Central government, in those days, is a license Raj. They were not planning to identify the right kind of entrepreneurs. They were only reasoning out what kind of industry should come, but they were not aware of the right people who could take up to tackle these projects. They have passed on those licenses to state governments, and state governments started industry development corporations. These people also didn't make much effort to identify right kind of entrepreneurs. Mostly it was done for as a favor to minister's son-in-law or bureaucrat's relative. They are the entrepreneurs. The joint venture concept is 50% by state government, 50% by the entrepreneur. To check how the company is running, what the health of the company, we were nominated on the board of the promoted joint ventures. During that time, I noticed that all giant ventures promoted at that time, I'm not talking about nowadays, in 77, I joined state government. Most of the industries were running in losses, and they were not very serious about running the company effectively. And when I was nominated on the board, I was not able to read through the balance sheets and the financial statements. Then I did my evening MBA in Usmania, which is not of much use. I'm sorry to say that. Probably now they improved it. In 80s, I joined evening college. At least I learned how to read a balance sheet. It is not one balance sheet any company has. They used to have 3 to 4 balance sheets. One is for himself, be truthful. One is to the bank, to mesmerize them. One is to income tax. If they make profit, they have to cover. Like that, one balance sheet reading itself is difficult for me. They were making 3 or 4 balance sheets. I found that this joint venture concept is not effectively, healthily working. So when I brought this to notice of my boss, he said that you should adjust and go move forward. Don't make complaints. Then I said, not a place for me to work. I left it. Then I joined an ongoing battery company, a great educationist, very highly qualified person. He was actually, he promoted a company for import substitution of defense batteries. So he was most of the time spending on teaching and writing books. He is highly academic, very knowledgeable. He thought he should have a practical person to be his associate and partner. I joined him, and we together ran very well. Though he could not run it alone very effectively. And after I joined, I have filled the gap of being practical and work-oriented. He is highly theoretical, very knowledgeable. He used to guide me. I used to work on this. Karyarangam Nadi, Alochana Rangam Ayindi. He used to think, I used to work. Our combination did very well. And finally, we made it very good. But his way of thinking was different. My way of thinking was different. He didn't like my approach to the life, and we were bitterly separated. It is not a normal separation. Actually, he has eased me out of partnership. I was on the roads without getting what I was supposed to get also. It was a legal battle. I was in depressive mood at the time. I was not able to cope up with the tragedy that happened to me in my career. I thought of going back to my village, and my father has agricultural properties. I thought of cultivating my land and then be peaceful at village. But again, Providence, I was trying to pacify myself to forget this bitter experience of partnership division. I went to my cousin in USA called me to forget this episode and then forget about that whatever happened. For that change of place, change of mood, he asked me to come over there. I went to Cincinnati. There, my cousin was a life sciences scientist who worked in Hyderabad in NIL. There, he was working in Environment Protection Agency, EPA. Okay, he had an opportunity to present a paper on impact of immunization. WHO organized a seminar in Geneva in 91 October, or maybe early of 92, if I don't exactly remember. Because I was a guest with him and he was going to Geneva, I tagged along with him to Geneva summit organized by WHO. And I was only a spectator. I cannot understand ABCD of what they are speaking. WHO officials were making statements that they were very bitter in their statements that many countries have followed the immunization schedules properly, but there are some countries who do not care about our mandates, whatever we are giving to them. Every newborn child should be vaccinated according to the regimen we are giving, according to the schedule we are giving. And 90 countries are following, but the rest of the 30, 40 countries are just, they are deaf to our comments. They are not taking initiatives. And such countries, the children are suffering, and major issue is India. In India at the time, it seems 45 million children were affected by hepatitis B infection. First time I heard the name hepatitis B. It is a liver infection, and my cousin was briefing me, and he was giving me insight in and out of that in a small way that I could not understand what they were speaking. But the main scope of the lectures, any speaker was giving, the lecture was that India and China and other countries, neighboring countries like Bangladesh, Pakistan, etc., they were not adopting hepatitis B into the immunization schedule. They are not caring about their children. They are coming with a begging bowl for subsidized vaccines as and when there is an epidemic. Now for COVID, how much hangama we did. In those times, in 92, 93, when 45 million children were affected with hepatitis B, and 1% of the affected children can get into liver cirrhosis and they can die with liver cancer. It can affect even adults also. Death rate may not be much, but the productivity of the adults will go down, and they will be most burdensome for the society. They cannot deliver anything. They will be dependent on the family. With the affected liver, they are not normal. Most of the times they may die with liver cirrhosis. At the time, they made a statement that more number of people die in a day because of hepatitis B than due to AIDS in a year. So the seriousness is very high. AIDS was just now coming up. That news is coming up that every country is having 8 cases. But WHO themselves made a statement, more people die in a day because of hepatitis B than due to AIDS in a year. That was the seriousness. And they gave a mandate that by 1987, every nation should adopt hepatitis B into their immunization schedule. In immunization schedule, conventional vaccines like DPT, diphtheria, pertussis, tetanus, MMR, measles, mumps, and rubella, BCG, the TB vaccine. These are the things in the immunization schedule. Now they are asking us to add hepatitis B. Then I asked my cousin why we, along with Nepal, Bangladesh, Pakistan, Myanmar, Sri Lanka, etc., why India has not added this vaccine into the schedule. That is very costly and it is not available in the local currency if we have to import it. I tried to get this. Why not this be done in India? It is difficult. I don't know much about that, but we can inquire about that. That's what my cousin said. Then I came back to India. I approached some stalwarts in pharmaceutical line. They are big companies. They are well-known people. For example, Dr. Reddy, and I approached them. They said that it is what you are talking is hepatitis B. They have done it in recombinant DNA technology. It is a high end of biotechnology. We are not ready for it. It will take time. It will take 20 to 30 years. That's what his opinion. Then I inquired about the same thing with some other company in Ahmedabad. They also said that, sir, it is a biotech-based vaccine. We cannot do that. Recombinant technology is very new. It was introduced in 1988 and the vaccine came in 88. Recombinant technology, we are not well versed. There is no biotech company as such in the country at that time. Then when they cannot do, they don't want to do it, I thought I should do it. Though it is not my subject, the kind of insulting words they were uttering in the Geneva seminar, that begging countries coming with a begging bowl for subsidized vaccines, they don't care about their children, etc., was very hurting. So I took the plunge to get this technology and get it manufactured here. That is a irrational thinking because I'm an entrepreneur at the time. I don't know the domain, life sciences, I do not have any idea. And it is newly introduced in US also, 88. I'm talking about 92, 4 years. And people here, stalwarts who know the technology, or else at least the vaccines and the pharma, they were afraid to take it up, and they were of the opinion it will take some time to take that challenge of making recombinant vaccines in the country. I was thinking out of box, and then I was rational in my thinking. I dashed on to US. I approached the company which is making this. They developed this, and they have transferred the technology to SKB, SmithKline Beecham in UK. And in France also, they were doing this vaccine. I approached US company. They were also very reluctant to give this technology by making me to wait for 1 week to give me an appointment. And the gentleman was very, unfortunately, very, unparliamentary with me. He said that you are a big country, you don't need a vaccine, you have enough children. Very hurting. And he also said that you are a poor country, you can't afford this high-cost vaccine technology. Maybe I can accept that because money is not that is freely available in India to take up a project like this. Then the last word what he uttered was very insulting. Even though you can afford to pay me technology fee and I give the technology to you, it will take 3 decades for you to absorb this technology and get into vaccine production. So forget about it, he said. I made a challenge to him that in 2 to 3 years, I will come back to you with a better vaccine than yours. But that is also foolish, rather unwanted or unwarranted statement with him. I came back. My cousin warned me not to pick up any war, and such kind of utterances will lead him in trouble because he's a government employee. And I am a visitor, which I am not supposed to talk in those days. I know the kind of environment in 1970s when I went to US. I was not allowed to park in the same parking lot where other Americans park. For Asians, there is a separate parking slot. That was the discrimination at the time in 70s. And in 90s, it may be a little different, but definitely not fully comfortable. The kind of opinion they have about India is lagging behind by 30 years. I don't want to agree with that. And I came back. Then I have taken up the plunge myself. I don't know the technology, and there is no model to emulate There is no biotech company. More than anything, I have no data on that. I approached Union Health Ministry to meet Joint Secretary in Union Health Ministry. I met him and he advised me that your background doesn't suit to take it up, and there are vaccine companies, they would have taken up. But all vaccine companies so far, what they are doing, conventional vaccines, are either they are importing bulk and then vialing them here, or they are buying the technology and making them here, or they are importing and selling it, but not developed by themselves any vaccine here. All vaccine development is not done in India. It is only either in Holland or Europe or someplace. I was surprised. My opinion is we have Central University, which is famous for life sciences. We have CCMB, Center for Cellular and Molecular Biology. We have NII in Delhi, National Institute of Immunology. We have NIV in Pune, National Institute of Virology. So many institutes are there, and in CSIR laboratories, there are 40 laboratories attached to CSIR. So much of research is going on. Many stalwarts are working in research. If they are given a task by central government, by any leader, that we have to have this vaccine to save our children, they could have definitely done it. My opinion is it was ignored or it was not remembered to take up this kind of task. It is a lack of vision, not lack of technology, not lack of knowledge, and lack of awareness also. Until such time, WHO warned us that if we don't take up this immunization schedule by 1997, they warned us they will not give support for any health programs to India and neighboring countries. They said they'll stop all the support for any health related projects. Government took it very casually in those days. In my opinion, it didn't occur to them to take up this task. They could have easily handled this vaccine. It's not a rocket science. Recombinant science is a new, agreed. But we have excellent laboratories. And ISRO, DRDO, they have done so much of good work. I think I should mention here, though it is out of place, ISRO done such a kind of wonderful work with fraction of the cost of what NASA is spending. We could achieve almost the same results as NASA got. We are maybe 2-3 years behind. But in some areas, we are even far ahead of them. We could launch 108 satellites at one go. They could not launch more than 6 or 7. We could launch 108. Our ISRO is no way inferior to NASA. My strong belief is our scientists are very strong. Their science is very good. Our engineers are very good. Even in America, which is, in my opinion, is a what you call country of immigrants. Most of the doctors are Indians, successful doctors. Most of the engineers working in either Apple or Microsoft or whatever it is, they are all from India. So our own people are going there and working. Can we not do it ourselves? Is my blind jump into the project. Here, I didn't make any calculation. What is the supply-demand gap? Where is the technology? Whether we have trained manpower, whether we have hands-on experienced people to take up this project, whether I'm going to get adequate funding from the banks. I didn't have any idea what is the size of the project, how much equipment, what equipment I require, how much project size it is, I don't have. It's a blind jump. That's what one stalwart from pharma said, you are taking a blind jump. You are a fool, you are an idiot. I don't know how we will come out of this, but don't be so emotional. It's not good for you. That is the advice I got. Anyway, I told you in the beginning itself, definition of an entrepreneur. You should be a radical thinker. You should be foolish sometimes. You should be bullish also. And he will not have anything to lose. What I have, I could not get my partner, whatever he supposed to give me, he didn't give it, has gone to court. I have to again approach my father for some money. And what all he could give is, he didn't sell away all his property, but part of his land property he sold and gave me. Some 68 lakhs in 93, he has given me. My friends and cousins, my classmate, 3 or four of them gave me some money. All together pulled up is 2 crores, which is not enough. I know that. At the time, Usman University Vice Chancellor happened to know me. I told him my episode. He has offered free space in molecular biology department, that is dilapidated room of 20 by 40 with broken chairs and tables. I got it cleaned up. A false ceiling and false roofing was done, and false flooring also done. Some air conditioners were fitting. He attached me a molecular biology professor, associate professor, Dr. Geeta Sharma. She started teaching me what it is, and she helped me in formulating a project report. She was teaching recombinant technology in the class for MSc students. I told you, in universities, the subject is there, it is being taught. Maybe they are doing some experiments, but not for a product. It is a learning curve. But if it is designed for a product, it is designed for making a product, I think our scientists could have done. That's my opinion. We made a project report and we applied to, at that time, Ujog Bhavan, Delhi. We applied for it. Finally, I could not get answer for 3 or 4 months. And again, I made another application. I could not get reply. I went and searched. I found it with the help of one Telugu person in Ujog Bhavan working in Ministry of Industry. He located that in engineering department, waiting for clearance without knowing what it is. They were confused. Our heading of the project, report for getting the license is genetically engineered hepatitis B vaccine. Genetically engineered, they saw only engineering aspect. They were sent it to engineering department where they approve lathes, machines, big mechanical machines. So finally I got it back and then we taught them this. Why I tell this is the kind of awareness in government circles is this. Newly formed Department of Biotechnology was there. I went there. There, they also felt that I am not good enough to take up this project because my background is not that, and it is not easy, and recombinant technology is further difficult, and so far no vaccine was ever indigenously developed, and it is not easy. Also, they told me very clearly, you approach Ministry of Health for protocols how to test this vaccine. There should be a pharmacopoeia, it is a medical product. Every product we make in pharmaceuticals should find a place in pharmacopoeia for specifications. When I saw that pharmacopoeia, Indian pharmacopoeia, there is no mention of recombinant DNA hepatitis B vaccine. So I had to request to formulate specification for recombinant DNA product, and Drug Control General of India, who is going to give me license after my development of this product, he has to design a protocol, how to test it, how to accept it, what are the parameters to test, how long we have to test, and what parameters you should test. Preclinical studies and clinical studies, like for any pharma product. All these things were absent in Drug Control Department. I approached them. I insisted them that they should form a committee to evaluate the possibility of coming out with some specifications for recombinant DNA product, which should be published in the pharmacopoeia. On that basis, I had to develop my product. Finally, with so many rounds of meeting with them, because, in government, ego plays a very vital role. They don't have protocols where I say that I can bring it from outside. They don't accept it. Why we should bring it outside? We can develop our own. Okay, how to develop it? We have to form a committee. When you will form a committee? Next week. That next week doesn't come. Even if they make a committee, they unnecessarily draw from different departments: Ministry of Environment, Ministry of Forests, Ministry of Science, Ministry of Engineering, Ministry of maybe Biotechnology. Biotechnology department was there, but not ministry. So many ministries, representatives, they are all mostly IAS officers, not technical. And they come and meet, they have to evolve a protocol, how they can do. Even if they invite some experts, scientific experts, and if they take their opinion, they will not come to a conclusion. Most of the time, the forum, when they meet, the quorum is not complete. The requisite number were not there. If the quorum is complete, they don't take a decision in one meeting. If they take a decision, the minutes are not ready. If they write the minutes, it is not signed in appropriate time. So I had kept on waiting for almost 1.5 years to get this solved. It is a single man fight, and I have no at that time much paraphernalia. I used to travel to Delhi every week or every 15 days, sit with the different departments, wait in the corridors to meet the concerned secretaries, additional secretary or joint secretary, get the clearances. Department of Biotechnology has given 4 or 5 steps here. There, you will be surprised to know, Institutional Biosafety Committee, I have to get through that. RCGM, that is Review Committee on Genetic Manipulation. Next committee, Genetic Engineering Application Committee, then Drug Control Journal of India. After all these things, I had to go through preclinical studies approval. After preclinical approval, I had to again apply to DCGI. After he approves, then it has to come to the committee, special committee for ethics committee for allowing clinical trials on humans. They approve, then I had to go with that approval letter to concerned hospital. And every hospital will have their own ethics committee. And the ethics committee have to meet and then approve this clinical trial. Then only clinical trials will start. In fact, at one point of time, I have done some exercise. How many clearances are required to get started a biopharma company? Was 63 steps, not 1, 2, 3, 63 steps. All these steps, most of them, in my opinion, are irrelevant, preposterous, unwarranted, age-old. See, when I want to start a high-end biotech company, first of all, that knowledge is not there in the industry department. They say that biotechnology, we never heard this. So you have to run away from the city for 40 kilometers. I was pushed out of 40 kilometers out of the city. There, no road, no communication. Okay. Then, when I have a plan to build what is the education level? And that sarpanch. The sarpanches, nowadays, not nowadays, in those days also. A Vishanidar, one lady will be a sarpanch and the husband will be running that office by keeping her in the front place. And she can only put her thumb impression, not even signature. And she has to give me permission. All these things are one part. After crossing all these limits, I think I'm running out of time. I have no experienced hand candidates. I requested my guide, who is associate professor in molecular biology department of Usmania. I collected the alumni addresses. I wrote letters to people who are, most of them in US or Europe. Come back for a good cause. We have to make our own vaccine. It is not available locally. That's why it is not added into the immunization schedule. Very costly affair. Country has no foreign exchange. At that time in 92, when I gathered, it is only $300 million for our foreign exchange reserves, just enough for 2 months imports. Now we have $570 billion. Country has improved, no doubt. But only thing is, the wealth is accumulated with 1% of the population. Around 43% of the country's wealth is with 1% of the population. That is this tragedy. In those days, when there is no foreign exchange reserves, government was not willing to import this vaccine in bulk and then give to everyone by adding into immunization schedule. That is the reason our government was not giving this vaccine in immunization schedule. So my purpose is to make it local available, make it available in local currency at affordable price. So next step is, I have no knowledge about that. This lady has given me some clue about it. I wrote letters to many stalwarts who got educated here and working in life sciences area in different good companies in US and Europe. Some of them replied by my patriotic letter that you should come back and give back to society what you have got educated. Is not 1 lakh what you spent to get a degree, but 10 lakhs is being spent by government to make you a degree holder. You should give back. You should give back. Unless you give back, you go to society. That's what I wrote. And some people responded. Some people came in. After coming here, after seeing that there is nothing here except myself in a dilapidated laboratory room in Usmania University. They went back. Some 2-3 people got attached to my thought process, and they were literally agreed to work with me, and they stayed back. I could make a team of 7 people with that lady, Usmania associate professor. We started working. After 1 year, we were asked to leave the place. Meanwhile, I was working for funding. No bank came forward. They said that the new subject we can't do. And you are saying that you are doing research. For research, we don't do funds. Only for proven technologies we give. Make a paracetamol, we can fund you. Or else make a re-rolling steel mill, we'll give you funding. Make a cement project, we can give you funding, but not for an unknown product. Like we never heard his name, hepatitis B, and that too, you are saying through biotechnology. Show me one company where it is working well. There's no company to show. Apart from making a good working company, where is the company at all? So in such circumstances, no bank came forward. I approached IFCA and IDBI. They were also of the negative opinion that you can't be making it. I even influenced chairman of Andhra Bank at that time, Dr. Narayanan, and he advised his general manager to look into the case. Probably he might have advised him to discourage me only, because the general manager spoke to me in a very diplomatic way. Yes, Reddy, you are coming for project funding and you want to do R&D. For R&D, normally we don't do, but chairman said that I should look into the project. How much is being imported into the country? How much is consumed this vaccine by importation? 1,68,000. 1,68,000. So if at all you make it, probably you will get 10% of the market share. That is, you are going to sell around 17,000 doses in a year. Slowly you will catch up 1,68,000. No, sir. We have 23 million babies every year, and there is backlog of children. For every child, we have to give 3 doses. My calculation is more than 150 million we require every year. He doesn't agree with that. Now it is consumed only 1,68,000. Your market share is going to be 10%. That's the template he was taught by bank officers. And then also his point is, at what price you want to sell. I want to sell it in, I don't know how much it costs, sir. I have not done any exercise on that. But my intention is to make it available at low cost, meaning, he said, meaning any other vaccine, what it costs, 50 rupees. BCG vaccine is around 50. DPT vaccine is around 45, 50 rupees. MMR is around 60 rupees. So I will match that price, 50 rupees. So you are only imagining, you are not sure. I am not sure, sir. 50 rupees, I want to give, that is my intention. Even if your intention is right and you are able to make it at 50, and if by selling 17,000 doses, how will you repay my loan? You want 15 crores loan. You can't repay my loan. So you are unfit for funding. So I had to walk away. No bank gave me money. I don't know the subject. I don't have experienced hands. With the raw hands, we started the work with strong belief that we have good science with us, commitment for the country. Our people did. It is not me done. Unfortunately, media will say Varaprasad did develop a vaccine. No, I got it developed by our scientists. Slowly, our 7 members, we moved to CCMB. The technical scientific ambience is CMB helped us. Not that they have given any technology to us, but that scientific ambience has definitely helped our scientists to do good work. When there is any doubt, we used to ask. We use their equipment. They have validated our product. We could develop our vaccine exactly after 50 years of it. In 1997 August, we are ready with our vaccine. But before that, there are some steps. We have to go through several clearances. I told you, preclinical, clinical. In preclinical time, we had a lot of difficulties. Animal love society. There are some societies who they love more animals than the human beings. Our Manaka Gandhi. She has asked me to fund for animal society before I start clinical trials on animals, preclinical trials. I said, I have no money. I have very little money to do. So I cannot do this. Then she has sent her volunteers to evacuate all testing animals. I lost 6 months of time, preclinical studies, saying that I am very cruel to animals. I argued with her, saying that your son has taken vaccine, I suppose. She said, yes. How that vaccine has come? after testing in preclinical and clinical. That means your son could get a vaccine only after going through preclinical and clinical. And you are using face powder. The face powder is tested on animal eyes. They put that powder in their eyes because every face powder will have mica resin, fine particles of mica. If that animal loses its sight, it is a negative point for the approval of the talcum powder. So all these tests were, unless it is done, proven that they are safe, without establishing safety, how can we make a vaccine? How can we save our children? In the larger interest of children, we have to have these clinical trials. It's a science protocol. How can you object to me? You scientific bastards, you talk anything, I don't allow you to do this. We went to court, we got cleared, but time loss. Okay. Finally, clinical trials, that also same problem. And before this, I had to go back again. Where is the funding? 15 crores has not come from any bank. And I could raise only 2 crores. A foreign national, Oman, is a foreign affairs minister. In his personal capacity, he came down to support this project, having heard this project about this project from P.V. Narasimha Rao. Let P.V. Narasimha Rao casually mentioned to him that one guy is suffering with this development of vaccine. He is having all hard times with the government. He is not able to withstand all this pressure. Then he said that I will support him, but we also know the importance of a vaccine. Our country has many what you call Rolls-Royce cars also, and we have equal number of donkeys on which our people travel. We have equal number of rich people and non-rich people. I need this vaccine also for poor people. So he came and participated. He participated 50-50 joint venture. He said that I am from a royal family. You can be 50% shareholder with 2 crores. I will infuse 2 crores as equity. Then we are 50-50, 1% not higher or lower than you. And I will arrange the term loan from Oman at his personal guarantee. He arranged it, that noble man, he arranged it with his personal guarantee, 15 crores loan. So we never looked back. With the 19 crores, we could complete, and we have come to clinical stage. In clinical trials also, everyone had a doubt because at the time, the Engerix B was the ruler, that the high standard hepatitis B vaccine from SmithKline Beijing. They started creating tremors in the eyes of ethical committees of every hospital. Don't test that, that will kill your children. It's not well tested. So I have to go to drug controller to stop this vilification campaign. He doesn't want to cooperate with me. Probably he is in line with the multinational company. Then I have to use a technique saying that this, whatever they are calling not well tested, it doesn't affect me, it affects you. You have given me the license. You have given me the license, so you have to safeguard yourself. They said that it's not well tested. Then he woke up. He has given me permission for testing our vaccine in comparison with the imported vaccine at 6 centers in the country, in Bombay, CCMB, in Hyderabad, and also in Calcutta, in Delhi, and Vellore, CMC Vellore. At all these 6 centers, we came with the flying colors, proved to be this vaccine is much better than the imported vaccine. The titers that have come, that is titer means that is the response, the saving element. The higher the titers, more saving. Our titers were 24,000, but the imported vaccine had only 480. With the 2 doses of our vaccine, the subject is well protected. For them, we have to do 3 doses. So, Vaccine Magazine published this data saying that a tiny company in India has developed a wonderful, effective vaccine for hepatitis B. That's how Shantha has become very worldwide known. WHO, we applied for WHO pre-qualification. After 2.5 years of struggle, we got that, and we could export to UNICEF at fraction of the cost of the imported vaccines. People were supplying, multinationals were supplying to UNICEF at $18. We have applied to UNICEF after getting the approval at 23 cents we supplied. In our country, for children, we are given at 25 rupees. For adults, we are given at 50 rupees. Here also, we have gone with innovation, saying that regular channel of marketing is very difficult. Even if I am ready to give a 50 rupees, that has to go from production department to my marketing department. Our marketing department is our own department, but they are all tie-clad and suitcase carrying high-fly people. They have their own expenses. They will ask 15% expenses for marketing. They will add 15%. Then they give it to a super stockist. He will add 10%. Super stockist will give to stockist. He will add 25%. Retail, it will go to retailer. He will take 20%. So my 50 rupees has become almost 120, 130. I thought it is not the way to do. I requested the IMA, Indian Medical Association, we will have the public vaccination. We will have on every Sunday or every holiday in a public place, mass vaccination camps. We took the permission of collector, IMA, doctors have come and vaccinated. Hundreds of children with their mothers were standing in the queue. We could do that. We reduced the marketing chain costs. And how we could do it 50 rupees, you can ask me. We have not followed the inventor's path. They have done in a particular style. We have done, our scientists have done in a very innovative way. We used a different organism, vector, which has given 12-fold increase in productivity. That is our innovation. We could get a patent for that. Unfortunately, in those days, process patents were valid. Now it is no more valid. In 2005, our government, by force, by developed nations, we were forced to sign GATT agreement, saying that process patents are no more valid, all product patents. Now I cannot make any existing vaccine outside the same name here. In those days, I could do hepatitis B, though there was a hepatitis B vaccine, because my process was different. In Tamil Nadu, they make sambar. In Andhra also, we make sambar. Sambar name is same. Can they fight with me legally that you can't make sambar? My sambar is different. My process is different. My ingredients are different. Name may be same. My hepatitis B vaccine is different. I use a different vector. My productivity is much higher. My sensitivity is very higher. My efficacy is much higher than yours. Even 2 doses is good enough. So that's how I differentiated from the inventor's vaccine to follower vaccine. We have done in the same spirit around 13 to 14 vaccines at fraction of the cost. Everything is fraction of the cost. So this saga continued and we could do what is required. My pain is here. Already we have touched 7:30. My pain here is we have done an affordable vaccine with local currency. Government of India should include this to initiative. I can sell to private markets, but it's a tiny company with low margins. My margins are only 7%, 6%. After leaving some money for R&D, because we have no funding from outside. The health minister, the foreign affairs minister of Oman, after some point of time, he said that, look, I have given you initial boost to support your R&D, everything. Now you are independent, good company. You don't need my support. I have to exit. My role is over. You should look for a strategic partner and look for it, and I will sell away my 50%, or else you buy my shares. I don't have money to buy his 50% stock. Then we brought one French company. That company came in with 50%. And also some of I have given shares to all employees. I believed in one thing. It is not a one-man show. The company should be, every employee in the company should feel that they are stakeholders in the company. That is the principle I followed as I was influenced by my maternal uncle, a communist, staunch communist. He said that worker is not a worker. He is your co-worker. You are also a worker, he is a co-worker. The benefits what you derive should be equal. Because you have invested, you may take more. But they are investing in shrama, labor. You are also working. You are also taking. So they also should be partners. They are not your employees. They are your shareholders. That's how everyone is a shareholder. All those people were lured by high valuation by French company. So they have acquired majority stake and they could go to 67-70%. Some people remained and I remained. Over a period of time, they went on buying out. Even I was asked to sell. They started investing more and more money into the company to bring more technologies and other products. So today it is more or less 100% FDI. That scheme has come thanks to our central government. Now in India, no good company will remain an Indian company. East India fervor is coming again back. Any good company in India will be subsequently will be owned by multinationals. They bring with a bag of money our people, our talent, our land, our air, our water, their money, and their IP. This is the sad part. Everybody will come here with bag full of money. They develop with our talent and they take the IP. They make more money. We are only serving them as coolies. This is the sad part of it. Okay, let me come back. Government of India should have included this discrimination schedule. At that time, in the coalition government, the health minister demanded 25 crores for his party to include this discrimination schedule. Unfortunately, he didn't understand that neighbor countries, even including Pakistan, which was in politically opponent to us, Vajpayee Garu wanted to make peace with them, and he made a promise to them that Lahore bus, the political adjustments. They asked not, bus is okay, but we need a vaccine from your country. We have developed a good vaccine. Give us 1 million doses. Vajpayee government at the time, PMO office asked me to give that 1 million. We have donated that vaccine to Pakistan. They are using our vaccine. Burma is buying from us. Lanka is buying from us for their immunization schedule. They incorporated the country what developed it, that government has not implemented. When I got twice technology award, first time I got it, I took it. Second time, when they want to again give me for new development, I put a condition, unless you implement this immunization schedule, I don't want to come for the award. After that, only this gentleman asked me for 25 crores. I said, I will not give. It was not done. In fact, Shantha was banned for any government purchases. That ban was only for a couple of months. Manmohan Singh has come. I informed him this problem. They removed the ban. They implemented. After 11 years of our introduction, coinciding with 50 years of independence, we have done the vaccine, and Parliament celebrated this. India has become genetically capable nation. Everything is okay. They have given me Padma Bhushan Award. More than 180, 200 awards they have given to me. DSR awards, CSR awards, Prime Minister awards, name it. Everything has been got, but it is not implemented for 11 years. Finally, it got into a schedule. This is the, what I want to speak out here is not necessarily we should be expert in the subject domain, number one. Number two, all hurdles, they are only challenges to you not to stop at that point. Fight it out. If the intention is noble, there are some 10% of the people in the government who are very noble. They also helped me. Not that every government official has disturbed me. 90, you know the ratio, Kauravas are 100, Pandavas are 5. So also in government, there are 5 people who are benevolent to help me. I could take their help. I could move forward. Any entrepreneur, if he has an intention to do good for society, there are people to help you. You should not stop. You should raise against the all odds. Kite raises against wind, not with the wind. You should have the stamina to hold. You should be what you call frustration proof. In Telugu, we call it Sigurenu Adagam Migilte, government office lo nilabadite, aa opikunte, if your intention is noble, you will come out successful. Shantha is an example. Shantha didn't lose any money. At selling at 23 rupees, not that we made millions of rupees, but we got a high valuation for the company because multinational people felt that this company is going to be an unnecessary impediment in our markets. We will limit that company by acquiring stock into that. And with that low-cost production, low-cost development, we make use of it for serving the southern part of the globe. Southern part of the globe, they can't afford to pay so much of money. Northern part of the globe, they are rich people, Europe and America. They can afford. They were very clever in thinking like that, and they got into Shantha equity. Now, here also they are increasing their prices because I have no majority stake in the company. I cannot rule them out. I am trying my best to come out of the company because it is no more, the same philosophy is not there, the priority is not there, and it is no more a Shantha. For 11 years, they bore with me. I am thankful to them. That is the condition. They should not change the name for 11 years. They should not change the philosophy of the company of making it available at affordable cost. For 11 years, things have changed. Management team also changed, and the new team has no attachment to me, to my sentiments, to my philosophy, and they only look for money. They are right in their own way. They have invested so much of money. They have to get their money. But my point is, any Indian entrepreneur, if he thinks of doing something, they should come forward and take up. We are no way inferior to Western brains. We are no way lack of innovation. We can innovate. Our own people are innovating outside the country. If government wake up to the call and make R&D at the core subject in this country, we can innovate here. I want to make a mention here. In those days when I started, when you spent 1 rupee, we used to get 150% raiti on income tax. They used to take it out. They reduced it to 100. We felt bad. They reduced it to 15 Modi time. Now it is reduced to 0. They are giving a signal to people that don't innovate. In fact, in those days, either innovate or perish. Now, if you innovate, you will perish. Make in India is what bringing two parts of the cell phone, snap it, and you make it here. It's all well done outside. A fourth class is employed, saying that we have given employment. And that girl or whatever it is, they put both the parts and snap them together and put it in a box. That is the make in India. That is the definition of make in India. The country is losing productivity because low battery. The country is losing the stamina to produce. In China, in 1991, they could supply 3% of the world requirement. Today, they supply 86% of the global requirement. America lost their manufacturing capacity. They are also into marketing. India slided down to from productivity to marketing, from marketing to now science, services. We are more service-oriented company now. And we are sending away our people to develop products for outsides. We are selling the people on an hourly basis to glorified coolies. And we are happily sitting here without any IP. The country has to progress. Again, manufacturing should be given priority. More entrepreneurs, more radical thinkers should come. More obnoxious people should come. And people should have fighting spirit. Irrespective of, despite of government, one should take up the challenge and they should cross it. There are people to help you. As I had help from some people of the government. And if your intentions are noble, entire universe will conspire to make it happen. Thank you very much.
Thank you, Varaprasad garu. I think you held us spellbound with your very personal narrative. What makes it so interesting and inspiring is that you have lived through every word you have spoken. It is not every day that we can get people who can speak from personal experience. There are a lot of questions which have come into my chat box.
Sir,
and
one thing I forgot to mention.
Yeah.
In Geneva, the comment was beggar countries, beggars. Shantha is of its production free of cost. We are donors. The other companies remained static. We are donors. We have We have raised our flag as donor. We are no more beggars.
That's a
That's all,
huge,
sir.
that's a huge change of scene from what you have seen in the late 70s to the current situation. Uh, but your last part is a little sad that after having grown it organically against all odds, it is again the story of East India, as you say. So let me take up the first question here, which says, compared to the experiences that you had when you conceived this idea of setting up, how do you see the government policies today to encourage an entrepreneur?
There is some definitely change, sir. I accept that. I cannot blame the same way. However, lot more to be done. Red tapeism is still there. Number one, corruption increased. Two, three, more than anything. See, myself and a stalwart, very noble person, Mashelkar, you might have heard the name Mashelkar. He was CSR Director General. I
He spoke.
approached him to reduce 62 steps. We could find out at least 8 to 9 steps we could reduce from 62 steps. I was amazed to see, again they have come back to 63 steps. What we did, they were undone. That is sad part. So things have improved. Government is moving. More entrepreneurs are coming. There is a level of confidence has come in entrepreneurs. You see, not only because of me, there are many people who are successful. Number two, more than anything, government, whether they are there or not, I don't bother about it. Banks have come forward to fund it. Now every biotech company is getting funding. And Department of Biotechnology, at that time, 150 crores funding. Now they have 5,000 crores to give to industry. Still, our spend on R&D is sub-minimal. National Institute of Science in America, annual budget for them is $27 billion. $27 billion. In India, our spend is 2 billion or 3 billion, not more than that. And with pharma, only one company called Pfizer, their R&D budget is 5 billion. One company, one product. Our entire private sector in R&D, including big institutes like Tata Institute of Fundamental Research, 4 billion. On every sector, it could be electronics, it could be textiles, it could be chemicals, it could be anything, cement or steel. Our expenditure on R&D has been very, very poor, and removing incentives for R&D is fatal for the country.
The next question is about how do you, and if so, how can you transfer this kind of social entrepreneurship spirit that you possessed, which led to Shantha Biotech, to the youngsters of today? Are you investing in any initiative for such a transfer?
Nowadays, I have been called by every university to talk about entrepreneurship. I have been doing that at my own cost. Probably I have done so far more than 150, 200 seminars. This is one way that in every college, at least 1 or 2 people can come out to become an entrepreneur, that too socially conscious entrepreneur. I think my purpose is served in a limited way. As an individual, I cannot do more than this. I am 75.
And there's an interesting thought or a question. Since you narrated the unsavory incident of the health minister, did you ever consider entering politics so that you can bring about good policies in the country?
No, sir. I never tried for it because my age factor. And I was very active until 7 years back in Shantha. I was only concentrating on adding more products. But at this age, very difficult. And youth should come. Normally, when I go to, my slogan is this, become a socially conscious entrepreneur. Don't be a job seeker, job provider. If possible, become a good leader. If anybody starts a leadership college or school or university, I want to donate some money to it. And I want to be a free time. I don't take anything. I will go and then teach. I will take up a subject and teach them. This country has enough engineers, enough doctors, but no good leaders. We need more leaders, genuine leaders.
There is something similar in the Indian School of Business, I think, for the family business owned entrepreneurs. They have a short-term course, not the regular MBA. Maybe that could be something you may have already explored it or already addressed some sessions.
Where, sir? Who?
Indian School of Business, ISB.
ISB.
Yeah.
ISB went and talked. They have a case study there, but now ex-CBI Joint Director Lakshminarayan Garu, he is thinking of a leadership school institute, for which I agreed. I am ready to fund it. That's what I told him. It has not taken shape.
Incidentally, Dr. Ramesh Mashelkar spoke at a FOSWL meeting a few months ago. So FOSWL members were fortunate to have heard about how he transformed CSIR from a dormant state that you witnessed to churning out patents from almost all those 40 or 50. There's a question about a diabetic drug. Apparently, and I don't know, one of your companies in the US, I understand, makes glaucoma, a non-invasive device to test blood sugar levels. And the member was, is it available in India?
Yes. It is to check the sugar levels through saliva. One company in Oregon state, actually I invited them to India. I funded that company. We are making that product, and it is yet to get USFDA approval. Probably in 6 months' time, we'll get it and we'll put it in market at affordable cost. No need to pinch every day to know your HbA1c. That will give the solution. That is a point of care to even villages who can give. They can test it by themselves, and then they can approach the doctor. Most of the time, people are not aware that they have diabetes.
I see. So is it freely available in the markets in India or? Not yet. Okay.
Not yet. It is going to come in 6 months' time.
6 months. Okay.
Diabetes, one diagnostic kit. Another is pre-eclampsia for expecting mothers. That is also very important. At affordable cost, we are trying to do that. That is also coming out. The company called Diabetomics India. I'm the chairman of that.
I see. Thomas, I think you have accidentally shared your screen. Can you please stop sharing your screen? Thomas?
It is only white patch.
Yeah, his phone, I think. Yeah. The next question is again revolving around the same 62 or 63 permits that you mentioned about. Today, the government at the center as well as many states are publishing their ease of doing business ranks. Do you think that this has translated to an easier regulatory mechanism on the ground, or do you still see that a lot needs to be done?
Sir, in Telangana government, KTR has discussion with us, and he made it easier in other terms, not on scientific terms. Scientific terms, he cannot, that is all done by central government. Drug control is the central government purview. Here, to get land, to get approval, to get a factory act, all those things, he eased it very well. Definitely, there is a lot of improvement in India. I mean, Telangana.
I see.
That Telangana is on the forefront of easing it out business. Excellent.
I see. Next one is, I think people also are aware of your other activities. So could you speak a little about your post Shantha Biotechnic active role activities, because you're also involved in many fine arts, support to fine arts, promotion of our culture?
I am involved in creation of music and collection of music. I collected almost for 60 years, I collected music. Not all, but where there is a value of Sahityam and Sangeetam, I grouped them together. I divided them into categories. I shared with many of the people who are interested in music, free of cost. And also I created music, and that also I shared with many people. 100 hours of music I created. I got them written and then tuned melodies. For melody, I given importance for melody. See, Carnatic music, only few people will learn, whereas mellifluous music is for everybody. Not necessarily that you should learn Carnatic music.
Yeah.
Shastriya Sangeetam is tough one. It is only for pandits. Of course, everybody listen to it as a routine, but Janapadam, the Lalita Sangeetam, that is what my main focus. And we created so much of music on that. And I published books both on humor and on spirituality. And in addition to that, I started a Shantha Vasanta Trust for helping people in for health cause, education, spiritual work, publishing books, etc. And I am taking care of some another ashrams, ashrams. I have an annual budget of 2.3 crores. I do that. In addition to that, the technology on technology front, patches for palliative care, they're not available in India. And Johnson & Johnson, they were selling at 800 rupees. I requested one Indian gentleman scientist to bring that technology here. I participated in equity. He's doing it here at 100 rupees.
Oh.
That is my initiative. That name is Sparsha Pharmaceuticals. And another is Diabetomics, I told you, for saliva-based diagnostic kits. And then one more company, I am helping them to make steel doors for the classified rooms. Class 1. In pharmaceutical, we require clean rooms.
Right.
Clean room areas, company is doing that infrastructure. I'm also with that company. These are all not for making any money, but of course, it's not a donation also. I participate in equity, and by being equity stakeholder, I have the chance to oversee how they are doing, how they are performing. I'm on their board. So these are my other activities. And artificial blood, that is very essential. Now you know that our blood banks are not doing well. And we are very difficult. Every day you see scrolling in the TV, we need urgently P plus blood or AO blood. And all blood banks are not very well functioning. And we need artificial blood, which will eliminate all this kind of hurdles. Anybody can get blood very easily. And that is, if they're successful, is the game changer. That company also, I am supporting them. They are doing that. Probably they will come into market in 1 year time. Lazulin Biotech. So like this, I am getting involved with social activities and my music, my literature, companies and trust activities. I'm keeping myself very busy. And more than anything, my intention is that society should bring better governments.
Right.
And social responsibility is that also. Whenever election comes, we should look into the manifesto. If they are uttering any freebies, we should not vote for them.
Mm-hmm.
They should give prominence for development. What kind of new laboratories they are going to build here? What kind of new initiatives they are taking for R&D purposes? No new incubators they should start here for startup companies. All such things, unless they do that in their manifesto, we should not vote. We should abstain from voting.
Interesting. Incidentally, J.D. Lakshminarayan garu also addressed one of our meetings. In fact, I think it was just the evening before he announced his political arangetram. That meeting was at Dr. Gullapalli's hospital, LV Prasad, and he spoke to us. Gullapalli also spoke to us. So we are very fortunate that you could spend the evening with us in spite of you're being down with the COVID. Really appreciate that. May I now call upon our Joint Secretary, Mr. Somasekhar Rao, to propose a vote of thanks. It's 8:05. So it has been a very interesting evening. Somasekhar Rao.
అవి చదవాలండి, నేను చూడలేము.
ఏదండి?
1 minute, sir.
Since are there in the comments are only comments.
యా కొన్ని నాకు పర్సనల్ విండోలో వచ్చినాయండి, కొన్నాను చాట్ లో ఉన్నాయి.
Good evening.
ఒక నిమిషం సోమశేఖర్ గారు, ఒక నిమిషం, ఆయన చాట్ చూస్తున్నారు వరప్రసాద్ గారు.
Okay.
Okay, they are only praises.
Yeah. Yeah, thank you. Somasekhar Garu.
Yeah. Good evening, ladies and gentlemen. On behalf of FOSWL Hyderabad and on my own behalf, I propose vote of thanks. President of FOSWL Hyderabad, Sri Venkateswara Garu, distinguished speaker, Dr. Varaprasad Reddy Garu, family and friends of Mr. Returi Bhaskar Garu, ladies and gentlemen. Thank you all for joining our 164th monthly meeting. This is the 8th monthly meeting in our 4th year without a break.
14th year. 14th.
14th year.
14th.
Yeah. We thank the family members of Mr. Returi Bhaskar Garu for establishing an annual endowment lecture in his name in the month of August. We also thank T. Satyanarayana Garu for logistics sponsorship for the month of August in the name of his spouse, Srimati T. Vasundhara. Thank you, Mr. Parikshit Surana, for reading the prayer. Thank you, Ms. Katharina Sushmita, for introducing the distinguished speaker. We wish you both a successful career ahead of you. The recent pandemic, while causing a lot of anxiety and fears, has also made every Indian proud that India produced an effective vaccine that serves many other countries too. Dr. Varaprasad Reddy Garu accomplished a similar feat several decades ago, and it was interesting and fascinating to know the difficulties he had to surmount to achieve the success he did. But what stands out is the way he has gleaned life's lessons from every obstacle and moved ahead with a determination while staying true to what he believed in it. It is not every day that we get to meet a person who has impacted the health and well-being of millions of people of his motherland. That he is now spending his time talking to youngsters and sharing his wealth of knowledge is a demonstration of his social consciousness and sense of societal responsibility. Add to that is a strong passion to preserve our culture, history, and heritage, especially our arts, and we cannot but marvel at his sense of purpose and commitment. Thank you very much, Dr. Varaprasad Reddy Garu, for sharing your thoughts with us and spending the evening with us. It is much appreciated. We propose to continue with these Zoom meetings till further notice. Please continue to follow COVID protocols as we are hearing of growing cases again and new variants being identified. The daily count in Hyderabad is said to have crossed 1,000 recently. Our forthcoming meetings are as follows. 17th September this year, Mr. Girish Reddy, former partner, Goldman Sachs, on the boards of Cornell University and ISB will deliver a talk on global attraction of US universities. 15th October this year, Professor Narasimha Rao Desraju, Honorable Professor, Biochemistry, IISc Bangalore, and Advisor, Chellakere Campus, IISc Chitradurga District, Karnataka, will speak on the Chellakere project. Next, 19th November this year, Ms. Padma Gurkha, Founder and Technical Director of Thermopads, will speak on empowerment of women through entrepreneurship and change in social norms. Good night, ladies and gentlemen, till we meet on the third Saturday of September, the 17th of our 165th monthly meeting. Stay safe and you can switch on your cell phones. Thank you.
Thank you then, and it's nice having all of you. Thank you, Dr. Varaprasad Reddy again. Good night.
Thank you. Thank you very much. Bye. Opportunity.